My name is Moses Holley, and I will be speaking to you about the barrier contraceptive on the diaphragm. In the table of contents, we will be discussing what is the diaphragm, the instructional usages, the failure rates, how to obtain this contraceptive, the costs, advantages, disadvantages, and the protection against STIs. So a diaphragm is actually a shallow dome-shaped cup with flexible rims made of silicone. It was invented in 1842, one of the oldest forms of contraceptives. Despite decades of restrictions by the U.S., diaphragms were frequently used in the 1930s. Until 1995, it decreased to 2%. So the usage for this diaphragm is to place it deep within the vagina, blocking the cervix to prevent sperm from entering the uterus or the fallopian tube. It prevents pregnancy by keeping sperm from joining the egg and by blocking the opening of the uterus. First, in preparation, make sure to wash your hands with soap and water. Apply 1 tablespoon of spermicide into the diaphragm and additional spermicide onto the rim of the diaphragm. Next, on part A, with one hand you separate the lips of your vulva. With the index of the center fold of the diaphragm, hold it firm and grip. Push it far as up of your vagina. Block the cervix. After washing your hands, for removal, after washing your hands, hook a finger on the top of the rim and remove suction. Then gently pull down and pull out. It's important that the diaphragm remains in place 6 hours after last intercourse. Apply additional spermicide deep within the vagina and keep diaphragm in place if there is additional intercourse. The diagram to the left shows what happens within the diaphragm with sperm to ensure that all of the sperm is killed. Do not leave the diaphragm within place over 24 hours. In the failure rates, so out of 100 women, 6 will be pregnant if they consistently use it correctly. Women that do not use it correctly, there will be 12 out of 100 women to become pregnant. So that's a good ratio. So where do we go to find this? To obtain this contraceptive, you have to have a prescription from your healthcare provider. The provider will perform the following. They will examine for conditions, size of uterus, comfortability of device, instructions of inserting and removing of the diaphragm. And most women purchase this contraceptive because it's safe, affordable, and convenient for the following reasons. It is small enough to fit in the pocket, usually not felt by the other partner, and can be inserted before intercourse. Immediately effective, no effect on hormones, no effect on breastfeeding, and lasts 1 to 2 years. And also is easy to clean, but make sure not to use powder or lubricant. The disadvantages is that it can be pushed out by some penis sizes, heavy thrusting, or certain sexual positions. It's difficult for some women to insert their vagina, may need to be refitted, for example, after pregnancy or miscarriage. And spermicide alone has its own disadvantages. It may cause redness or irritation, burning sensation while urinating, and also irritation and itching within the genital area. And what is the cost? It ranges from $50 to $200 for the medical examination. And for the diaphragm, it's $25 to $75. And for spermicide, it's $8 to $17. And sad to say that this contraceptive does not protect against sexually transmitted infections. However, if you include the male condom, it will ensure that you have little to no chance of STIs. Thanks for watching, and here are my references.